Good afternoon.
Good afternoon, sir.
You're welcome to our today's class on the course Principles of Farmers Technician Practice, PTP 111. We are still treating history of pharmacy. By God's grace, we are going to end this here by special grace of God. So let's see how far we can go before our time elapses. We have roughly 30 minutes to go. All right, so you already have the course materials, so let's just go through it. I told you that today we start from the history pharmacy in Nigeria, right? That's what we discussed in our last class. And today we are going over to the evolution of pharmacy in Nigeria. Evolution of pharmacy in Nigeria. We have looked at that in ancient. We are going. There we go. Sing it. I'm in class now. Please. Is that what we told you? Anyway, I'll still confirm from you. Alright, so we've looked at the history of pharmacy from before the ancient Egypt, the Sumerian era. Are we together?
Yes, sir.
Sumeria, then we got to the ancient Egypt. From ancient Egypt, we got to ancient China, Greece. We came down to India and Great Britain. Then we move over to the USA. Then let's look at Nigeria. So that we end here in Nigeria. And before now, the history of pharmacy in Nigeria is not well documented. You know now, from our great grandfather, no documents. I think I've talked about this in this course, right? There are no documents. Maybe the person they will say it was more like a story word telling. My father told me that this is how they do it that time. There's no documents. So it's not properly documented. So it's traditionally passed down verbally from what? One generation to what? Another what? Generation. But then it was not that the pharmacy or drug or medicine in Nigeria is not a folk tale. There were actually people like that in the past, and they transferred it from one generation to what? Another one. But the only issue, as I say, that there's no documents. Okay, that's the only issue. So if you want to know about it, if you meet those people, those people into it, now they will tell you. If they want to open up, they will tell you what their father told them, and what their father told them is what their grandfather told their father. Am I communicating? Yes. And it's normally limited to a particular what? Family, true of us, yes. Except maybe someone somehow was able to learn it. That's when he can now put under what? Family. Are we together? Now, so then, before then, in olden days, the traditional healers used clay, they used plants, animal parts for healing. Am I communicating? Yes. Before the introduction of Western words, education, and that happened around late 19th century. When we say 19th century, what is it by date? Current. Is it? Are we 19th century?
No. 19th century.
19th century is from when to when?
1900 to 2000.
No. 1900 to 2000 is what?
It's 19th century.
No, I don't agree with you.
Tell us what's 19th
We know 1999.
From 1900 now
1999.
to 1999 is 20th century. Is 20th what? Century. From 1800 to 1899 is 19th century. From 2000 to 2099 is 21st century. So we are in 21st what? Century. Are we together? We are in 21st what? Century. So 20th century, 1900. So in the late 19th century, that's when the Western education came to what? Nigeria. And the pioneers of this pharmacy, even though they didn't call it pharmacy that time, the pioneer were what? Early European missionaries. Are we together? So they play significant roles in shaping the pharmacy what? Practice. They started as, when they came, they get people that were serving as what? Apprentices, okay? So it started with what? Apprenticeships. Under what? Physicians. They were working as apprentices under what? Physician, and they were trained. Okay, so these early European missionaries played a role in shaping what? Pharmacy practice with apprenticeships under physicians, leading to establishment of what? Medicine shops. Medicine shops were what? Established. So that is where the whole thing started from. Now the first medicine shop to be opened, and that was around 1887. Have you seen that? Yes. Late 19th century, 1887. Was by who? Mr. Richard what? Zacchaeus Bailey. Am I communicating? He opened the first one, and having opened that, so he set example for others to do what? Follow. So then from there now, different people, all those apprentices that we are trained, we are called dispensers. They are called what? Dispensers. Where you got here, dispensing. Hope you know. Dispensing. They were called what? Dispensers. Alright, so now by 1920s, they started seeing the need to have a formal pharmacy what? So by 1920s, the need for formal pharmacy education led to the establishment of a school of pharmacy where? Yaba, Lagos. This Lagos. Most of the things, most of the first happened here. Am I completing? Happened here in Lagos. So by 1920, the need for formal education led to the establishment of a school of pharmacy in Yaba, Lagos.
In 1925.
In 1925. So in 1925, the first school of pharmacy was established in where? Yaba, Lagos. Alright, so now, you know, in pharmacy, we have what we call technical groups in pharmacy in Nigeria. Let me use Nigeria as an example. We have technical groups. I think I've told you about these technical groups now. We have hospital pharmacy, we have academic pharmacy, we have community pharmacy, we have industrial pharmacy. Am I committed? Then we also have I mentioned hospital? Yes. Yeah. So these are the technical groups under what? Pharmacy profession. So we look at how these technical groups were what? How they came up, okay? And when, what actually happened? Just a kind of summary. So we look at the evolution of the Nigerian pharmacy technical what? Groups. Now let's look at hospital pharmacy. You know, then it was general. With time, they started forming different what? Because pharmacy is vast. Pharmacy is an integrated course that encompass a lot of things. So there's need for this group so that you know where you belong to. Now I'm here now. I am in academic. My technical group is academic what? Pharmacy. Those that are in the pharmacy in the streets are in what? Community what? Pharmacy. Those in where they manufacture the dosage forms are in manufacturing what? Or industrial what? Pharmacy. And those that are in hospital. They are in hospital what? Pharmacy. Right, so now let's look at pharmacy practice. Now, as of 1900, there were only 4 hospitals in where? Nigeria. 4 hospitals, and they are situated. I want you to, in our next class, during our revision, tell me those 4 hospitals. They are located in Lagos, Asaba, Abeokuta, and Calabar. Tell me those hospitals.
We
should find their names.
Tell me, find research. Tell me the name of those 4 hospitals. In our next class, during our revision, we discuss it. Is it clear? Alright, so now this hospital, 3 of them we are government what? Why one is a missionary hospital owned by the Catholic Church. So I give you a clue. 3 government.
No, that's the
Tell us in our next class. Hello. Now we will go into research, studies, quiz, revision from now henceforth. So let me sharpen your mind again on research. So do it yourself. In our next class, you let me know. She did that to you. No going back. We are in it. We die here. We die here. Nobody runs away. Nobody is running away. Do you know, from my experience, to be sincere with you, I am not surprised. From my experience in my former schools, someone came to me. I was like, sir, I didn't know that this is like this. So they thought in the head, hey, go and do commerce technician. Just go there. Do it and they give you to go. Go and sir. So sir, you didn't tell us that we are here to study pharmacy. I said, what are you here to do before? Is it because they call it pharmacy technician? You are here to study pharmacy. She was like, I thought, you know that they just bring their O level. Some that don't even know who wrote those O levels. They just bring it, boom, and submit and go disappear. They come, they thought they will do it and go like that. They know that they are here to study pharmacy. So you need to tell us because in some countries, in some countries, they call this program diploma in pharmacy. It's not here studying. It's diploma. Like India call it diploma. They are specific diploma. They are off from the same category, the same thing. But here we call it pharmacy what? In Ghana, they call it something else in Ghana. I think so. There's a name they call it in Ghana. After I will check.
But can we stick with the name we call it here? Can we still use it to work anywhere?
I know.
Yes, ma'am. People they go like their own license before you finish.
Once yes, because there is no other category of that level in Nigeria apart from this pharmacy world. So it's same thing. The point is that if you now write your own exam, once you are serious with what you are doing here, there is no country you go you cannot pass there. Exam. It's not possible unless you play here. That's why I don't pity you. So far as academics you must study. I don't pity you. I don't pity anybody. The only pity I pity is when it comes to general things that has no business with academics. I don't pity anybody in academics. You must study. That's why you are here. You study. There is no pity there. The only thing is that maybe if you are sick or I can give you space to rest.
What about somebody that is pregnant?
When you are done, you come and write the exam. I can't because you are pregnant. I will just give you man. No, you study. I give you space. You rest. When you are okay, you do what? You come. You must write it. It must come from here. There's nothing good about that. So there's no pity there. Hello. Because so that tomorrow I can confidently, the pharmacist you are working on with can confidently leave the place for you and go to where you want to go. And people can confidently come to you. Am I completing? If you are not grounded, we are producing time bomb that will explode tomorrow. It's wrong. Hello, I'm not a party to that. Hello. Alright, so God bless you. That bomb. And when it without exploding, in different places. People will be dying up and down. No, I don't follow that one. So far they call it teaching. We must teach you. So what is exam? You must write the exam. And you must get it. Unless you are tired, you go. Hello, now.
Okay.
So now, these hospitals utilize. They have a shared hospital formula. Sorry, I mean formula is not formula. They share the same hospital. 4 of them share the same word. Formula. Now, they were also, apart from those that are named hospital, there are also small mission that you can illegally call hospitals. Small mission medical what? Setups. You can't really call what? Hospital. But they're also there, maybe they from there they can refer to hospitals. In different places they set maybe all those who are now led to what we have as what primary what etc. now because for them because you cannot everybody can. I can remember that time that my grandmother used to tell me how they were trekking to go to the hospital. They will trek from one local government to they will pass up to three local governments to go to one mission hospital at that time.
So we don't die before the agency.
So there was need for that medical setups where they can handle some things locally.
Yeah.
So if it's what they cannot handle, they will now do what? Refer. Yes. Now, so this one we are not actually classified as what? Hospital. They were in some terms, coastal towns. And there was a kind of steady increase in the number of hospitals. With time, there was number of hospitals started what? Increasing. And this happened between 1900 and 1960. Mainly government mission. Then private. They are not like private then. What you have mainly here, what? Government mission. Now, let's look at okay, let me see. Good. That's the right thing to do. Not in fact, you are wise. You are wise. You get up, don't sit down and be sleeping, and be transferring sleep from one day to another. Alright, let's look at community words. Okay, Chibu. You can never stay the head of the class. You are never for what? Stay the head of the class. It's well. Now, let's look at community what? Pharmacy practice. Now, the first medicine shop was inaugurated in when? 1887 by who? Richard what? Zacchaeus what? Belly. Where? Balogun Street. Lagos. Good. Balogun Street. So there he served the European, what is it called? European clients and some few African elites. And people that are, that. Now with time around 1920s, other retail pharmacies started what? Emerging around 1920s. 1887, 1920s. Other retail pharmacies started what? Coming up. Are we together? Now, in 1924, West African Drug Company Limited was formed. Am I communicating? In 1924. And also, medicine stores by Chief S.T. what? Usu and the what? Mr. Robert Olatunji Adebo what? Adebo Wale. Then we have the Phillips medicine stores by Thomas King Ekundayo what? Phillips. That was in where? 1940. All this will happen around what? 1940 in Lagos. Then after several years, retail pharmacy started entering the what? Old Western and Eastern what? Region. Northern region around 1940. Sorry, 1960. Now by the close of 1960, by the end of 1960, there were up to 150 community what? Then, but the total number of pharmacies as at that time, both those in the hospital community were around 542. Now let's look at industrial pharmacy practice. So industrial pharmacy practice became apparent around what? 1944. Because the first, those that came in was May and Becker M&B. May and Becker M&B around 1944. They came in. Then after May and Becker, Blazo, GSK, hope you know that, Blazo, the present GSK. Then Pfizer came in. That was around 1954. So, but then they were not manufacturing. They were just importing and marketing. They import from their country they came from, and were just marketing their product in Nigeria at that time. But with time around 1960s, then we started having local manufacturing started coming up. Local manufacturing companies started what? Coming up. So those that manufacture in large scale, they start coming up. Are we together? Then, but currently now, there are about 115 registered pharmaceutical manufacturers in Nigeria. Above, or not total, above. If you get your MDEX, those that pay for the MDEX is coming on 13th by God's grace. In fact, they wanted to send it yesterday or so. I said no. I have promised so that those that want to pay can pay. Because if this batch comes now, maybe what happens is, if this batch comes in now, any other person that want to pay will wait until we are up to what? 10. Except, but I pay for extra one. Maybe anybody that is interested, once you come, if you do that, I can send to you, no problem. Just one extra copy. One extra copy. No. It's the same.
You are very good though.
Me?
Yes.
Me.
You are nice.
Are we together? Now, so we have over 150. So in that MDEX, if you open the back, you see a lot of companies there, manufacturers there, importers there. They are the back of it. But we have over 115 manufacturers in Nigeria. So they manufacture a wide range of pharmaceutical dosage forms, pharmaceutical dosage forms, and the different classes of them. So the contribution of this company include providing reliable, high quality pharmaceutical products to medical professionals and patients in various communities in Nigeria and West Africa. Some export too to West African countries. Yes, at least I'm sure of Enzo exports. I'm sure they export. Then maybe the other ones. Some manufacture here and export to other African countries. Now let's look at academics. Are we together?
Yes.
Now, pharmacy education in Nigeria had evolved through different stages. Now, remember I told you that the training started informally as what? Training dispensers. Remember, those that are good, they are called what? Dispensers. Now, training of dispensers through where apprenticeships happened around 1887 to 1923. So here now, Nigeria, we are trained to prepare basic medications leading to opening of different medicine wards. So if they train you, you can open your program. Am I completing? So with time, that was they prototyped it to that of the first person. Who is that first person? Mr. Who? What's the full name? Mr. What? Richard Good. Because there may be other babies, the two of us. So don't go and write the babies for me. Now, around 1925, formal training as pharmacy began. So here now, they started seeing the need for a more structured education. That led to the establishment of the School of Pharmacy where? In 1925. They want to be more structured now, not just anyhow you come, they train you, go. They won't even know what you're doing again. No. Whether you are training people, they don't know. So they now structure it well for proper education. So you properly educated well about human being, not just about drugs alone, about computing. Now, between 1927 and 1972, you start seeing training from being called dispensers now. They're not only going into pure academics now, not just about training dispensers. Because of the training that they received that time, they're not going into a lot of things about human body, basic things about sciences and other things about drugs. And they were now called chemists and druggists instead of dispensers. Instead of just dispensers, they are only just to dispensing. They are now called what? Chemists. So that name you see, chemist, is a archaic name for pharmacy what? Premises that time. That's why our fathers were calling it chemist. But now it's not chemist, it's pharmacy. That people they are calling chemist that time, our druggists are those we call pharmacists. Am I congregating? So we stand, you will get to where everything turns to what? Pharmacy. Are we together?
Yes.
Now, so then School of Pharmacy in Zaria, then we start seeing the School of Pharmacy in Zaria and Yaba began providing diplomas for registration. Am I congregating? So if you not seen that from just ordinary trainee, they now talking about what? Diploma. The diploma in what? Chemist and what? Druggists. Those chemists and druggists, what they had was what? Diploma. Those trainee dispensers had just certificates. Training certificates. So some of you do go and do training. What they are doing at that time is what we are doing now. You go, they train you, they satisfy that this person was trained here. No. Come here, Richard, come here. Fast. Carry your book and come, everything. You are losing concentration. Come here. Sit here. So, the School of Pharmacy in Yaba and Zaria, they provided diplomas for these what? Chemists and druggists. No longer certificate now. It's now diploma. So, chemists and druggists, what they had was what? Diploma. The certificate they had was what? Diploma. Now, this happened between 1927 and 1972. Now, while we are still between that 1927 to 1972, where they were still having diplomas as druggists and chemists, some of them that still wanted to, around 1963, listen carefully now, around 1963, Bachelor of Pharmacy began. Are we together? Bachelor of what? Pharmacy what? Began. So some of them that we are enthusiastic in becoming pharmacists continued. Have you seen it now? Some of them continued as what? Went to university and continued Bachelor of what? Pharmacy. Not all joined to continue for Bachelor of Pharmacy. So remain as the diploma. That's why today we have pharmacy what? Technician. They remain at that what? Diploma. They didn't continue for what? Bachelor of what? They say I'm okay with this one. They remain there. Some continue the thing. You know, it's evolving. As if those some that do not want to go into the druggists remain certificate dispensers. They say I'm okay. Those ones, if they are still alive today, are the ones that they call pharmacy assistants. They are there as pharmacy assistants. Have you seen how what we have today now? Pharmacy assistant, pharmacy technician, bachelor of pharmacy, doctor of what? Pharmacy. Now, so this bachelor of pharmacy began around 1963 to present now. So what happened? The bachelor of pharmacy began for training of what? Pharmacists now. No longer chemists, druggists. pharmacist. They now enter the pure degree in what? Pharmacy. So university program, universities that started that at that time we are Obafemi Awolowo University started awarding Bachelor of Pharmacy in 1963, and other schools with time other schools started what? Awarding it. Are we together? Now, after that, pharmacy kept evolving in Nigeria. That today we now have doctor of what? Pharmacy, PharmD. That one started in 2016. Which schools was the first to start it in Nigeria? Who knows? Uniben, God bless you, go far. Uniben began doctor of what? Pharmacy from 2016. So now some pharmacists that had Bachelor of Pharmacy say, okay, let me now do conversion program. Some went there and do 3 years. Now they are doctor of what? Pharmacy. Some say, I don't care, I'm okay with Bachelor of Pharmacy. They are there. Some decided to go and do normal masters and continue PhD. But some say, I will go to Uniben and do master and do conversion program to continue as doctor of what? Pharmacy. You know, PhD is not doctor of pharmacy. PhD is doctor of philosophy. I'm talking about doctor of pharmacy now. Doctor of pharmacy. PhD is not the doctor of pharmacy. PhD, doctor of what? Philosophy. Doctor of pharmacy is PharmD.
Yeah.
That's what I said that Uniben started. Now other schools are now offering PharmD. What it means that from JAM now, from first year, you now do 6 years. But some schools are still offering Bachelor of Pharmacy 5 years. But some school, at least I'm sure of UNN now, I'm sure of UNISIC now, I'm sure of UI good, UI. Other schools have joined Uniben to offer doctor of what? Pharmacy. But you now do it 6 years. Why those that are still offering Bachelor of Pharmacy, B-Pharm, do 5 years?
If you want to tell us in the open market, the level that B-Pharm can operate to, and the level that doctor in pharmacy can operate, their boundaries.
No, PharmD is more clinical oriented, and there's no much effect, much different as well. You know that PharmD is more clinically oriented. If you now go to hospital setting, now that's where you start seeing. Initially they were not recognizable, but presently now that we have what is it called? There are this scanner that they've created, but I don't know whether all the hospitals have started looking at it. Called pharmacy consultant pharmacist.
They fought for that to me.
It was a topic of, but now some hospitals, in fact, it has been approved. But those that are not doing are just doing local work, politics. Am I complicating? Yeah. The same way we have consultant gynecologist, we now have consultant pharmacy in different specialties. So that with that PharmD now is suiting because of the same 6 years. They are into what? Consultant pharmacy. Our doctors are doing their own consultant. You also continue with your own aim as a consultant pharmacy.
I want to say something. Like when I was working then, my boss, each time we are having treatment, like we want to give injection, also we say that we should not put everything we are doing, we should take it inside because she is not PharmD.
Okay.
You understand that she don't have PharmD, that it's only PharmD that is permitted to give injection and other things.
Okay. The point there is that like me, I don't have PharmD. But what I have is what? Yeah. But the point is that the best thing I know is that they are more clinically oriented. But as for the issue of giving injection and not giving injection, that your doctor of pharmacy doesn't make you a medical doctor. You are doctor of pharmacy in terms of drug-related issues, not treatment. Am I communicating? Yes. So for now, I can't talk more on that for now. But the basic, I want you to understand the basic that the doctor of pharmacy doesn't make you a nurse, or even if you have doctor of nursing, doesn't make you a medical doctor. That's one thing we should understand. And I think that's where they're having issues. Some doctors think that they will not come and start dragging. No, it's only someone that doesn't know what he's doing. You can start dragging. You are making a doctor. Do your work, the diagnosis. Me, I'm a doctor in pharmacy. Drug related issues, we discuss it. Am I communicating? We discuss it. Am I communicating? Five did what? We are because you have see. I told you if we end this class, I won't talk about this again. Just one paragraph. We end, please. One paragraph, please. We end this. Then let us do it and go. So that next time we know that we are focusing on quizzes and other things and what revisions. Now, let's just look at the pioneers of pharmacy in Nigeria. Pioneers of pharmacy in Nigeria. Of course, we already made mention of what Mr. Richard Zacchaeus Belly. They used to call him that time the doctor. So he was the first that opened the first pharmacy in 1887, Balogun Street, Lagos. He trained, listen carefully. He trained notable dispensers, and these dispensers later continued their studies. Some become physicians, some became what? Physicians, some became pharmacists, some became nurses. Am I competing?
Yes, sir.
Where they have more interest, they now went into that and became notable person in that line. So some of these people are as follows. We have Alfred Philip and Julius Appenna. We have Emmanuel who? This person was the first registered Nigerian pharmacist. Can we clap for him? So Emmanuel was the first registered Nigerian pharmacist, beginning in 1902, before opening his own medicine store in Lagos. Then Thomas King Wu Phillips was born in 1884. He was trained as a chemist and druggist and opened the Phillips medicine in where? Faji Market. He also became, this man also became the first president of the PSN, the first president of Pharmaceutical Society of Nigeria. Then the next person is His Royal Highness Oba John Wu. He was trained as a dispenser in 1917 and he served in various Nigerian towns before he became a founding member of Nigerian Western House of Chiefs. Another person was Sakofo Aboyomi, right? He worked as a sergeant. This one worked as a sergeant dispenser during World War I, and he gained valuable experience. Next person is what? Professor Dr. Cletus. He was my lecturer in UNN. He taught me UNN. The man taught me UNN. Wow. So he was the first academic clinical pharmacist in Nigeria. He was the first academic clinical pharmacist in Nigeria and the first professor of clinical pharmacy in Africa. No, he went far. He brought clinical pharmacy. He eventually brought clinical pharmacy in Nigeria. As far as clinical pharmacy is concerned, clinical. So other pharmacists are as follows: Chief St. Hapunu Wusu, Mr. Azaria Olusegun Ransom Kuti. You know that Ransom Kuti now, right? Yes. Then Chief Mrs. Ekanam Bassett. So we'll stop here. Any question? Any question? That's why I reserve it to the end, so we can discuss. Any question? What's your name? So you are the Almighty George. So you are the Almighty George. More power to your ego. I'm impressed. You are bullying me. Two of you are bullying me. Please. Huh? I know. All right, thank you very much. God bless you. See you next time.